People all across the world have lost their jobs or have been forced to work from home during the COVID-19 pandemic. My mom, Tina Graham, has spent every day during the pandemic managing the radiology department at the Mountain View Regional Hospital in Las Cruces, New Mexico. Graham said she has seen a decline of patients coming into Mountain View since the pandemic started. She also said there are new procedures every person who enters the hospital must go through.
They screen you, so they treat us like patients too now. When we go into work, you have to answer questions about where you traveled and who you've come in contact with, and then they take your temperature.
So how fun was it telling them, hey, my daughter just came back from California?
From California, right? I asked him about that because in the beginning it was you couldn't go to work if these things happened or if you came into contact with these people traveling from this area. But I think that it spreads so much that they can't tell you can't come to work now.
While she spends her workday managing the department in her office, Graham said it is the X-ray techs who go through the most during the pandemic. X-ray techs are the ones currently working on the front lines to take X-rays and CT scans, the two main procedures used to see in detail what happens in the respiratory system of patients with COVID-19.
Their anxiety is high because they're scared of getting the virus while they're working on these patients.
Like her X-ray techs, Graham also worries about bringing home the virus from work. One of the scariest parts, she said, is the possibility of being asymptomatic.
What if I did catch it and then I brought it home? And I wouldn't know.
And you infected your cats.
Right, and then the cats. Although that's not proven. But other family members, or even just visiting somebody, or going to the grocery store and sneezing and that kind of thing. So
Graham said medical school training includes taking time to prepare students for disasters, such as a pandemic.
They warn you that when you get into the healthcare field that it's not always going to be easy. Your patients are not always going to be walking and talking. And right now with the COVID, it's with really sick people with a very contagious disease. So they prepare you for that.